Stand up for more than a campaign. Stand up for a cause. Join Iowa in getting something done on health care.
Total costs related to chronic disease, including direct expenditures, healthcare costs, and indirect costs such as lost productivity, amount to $7.6 billion.
And it's not just about cancer. It's about diabetes, it's about heart disease, it's about all kinds of things that have just literally taken over our communities.
Well, I think it's very, very important for people to focus on chronic disease. There are human issues involved, there are monetary issues involved. It really is to the strength of our economy and the strength of our families.
You have seen all of the commercials, plenty of them. You have heard all of the interviews and sound bites on the network news. But now it's your turn. On January 3rd, Iowans will attend 1,781 precinct caucuses around our state. But what you may not know is that we will do more than select delegates for President of the United States. The precinct caucuses provide us with a critical opportunity to voice our support for policy resolutions at the caucus. Think these are just routine bureaucratic plans that will sit on a shelf? Think again. There is one resolution you should pay close attention to, a resolution for an Iowan like Holly Sager.
I never once thought that it would happen to me. 2002, my entire life changed. January of that year, I found a golf ball-sized lump in my armpit. I went in and had a mammogram and had an ultrasound, and we found out that I had breast cancer. And there's not a day that goes by that I don't think about what my life was like prior to cancer. It's the first thing on my mind when I get up in the morning, and it's the last thing on my mind before I turn my light out at night.
The Partnership to Fight Chronic Disease was created to cut through the red tape and excuses regarding healthcare inaction. Instead, the partnership is focused on finding real-life solutions on healthcare that begin moving the country toward a healthier vision. The numbers are clear, and Iowa leaders have joined together to support the Partnership to Fight Chronic Disease.
The health of an individual is one of the biggest indicators of their personal economic opportunities. But the health of people in a community is one of the single biggest indicators of that community's vitality. The health of a state is one of the biggest indicators of its ability to grow its economy, and the health of our citizens in the United States is probably one of the, if not the biggest indicator of global competitiveness in the 21st century.
This is the first time, I believe, ever that the Republicans and Democrats have come together on a caucus resolution. So in every caucus across the state on January 3rd, this resolution will be introduced and discussed.
Well, I think it's very, very important for people to focus on chronic disease. There are human issues involved, there are monetary issues involved. It really is to the strength of our economy and the strength of our families. I celebrated my 57th birthday on December 13th. It was a very important birthday for me. My mother, my father, and my sister did not get to their 57th birthday. My mother died from cancer. My sister had a heart transplant and ultimately had to rejected the heart. And my father died from a long-term bout with heart disease. So I wanted to make sure that I lived long enough to see my sons married, to see my sons have children, and to see them progress, and to enjoy their career, something that my parents and my sister never had the opportunity to share with me.
So what can you do? When you attend your caucus, stand up and join your friends and neighbors in fighting chronic disease. Here is what you can expect when you attend the Iowa caucuses.
I'd like you to take a couple seconds and just imagine the day that Barack
Nearly
Obama
every
is
serious
inaugurated
presidential
as president of the
candidate
United States.
has come to the state to convince Iowans to caucus for them on a cold January night. The 1988 caucuses saw competitive contests on both sides, and candidates spent 999 days campaigning in the state. In total, Iowa has picked the eventual Democratic presidential nominee in 5 of the past 7 competitive caucuses. Iowa has become a proving ground for presidential candidates where they need to conduct the retail politics of traveling from community to community, answering the tough questions, and asking people for their support. In the modern campaign age of 30-second television ads and soundbite politics, it is important that Americans have the opportunity to truly test potential presidents, and Iowa offers that opportunity.
I'm happy to sign this proclamation. The proclamation reads, whereas chronic diseases are the leading cause of death and disability in Iowa, with more than 1 million Iowans suffering from at least one chronic disease, the state has reached a chronic disease crisis. I, Chet Culver, Governor of the state of Iowa, do hereby recognize and endorse the activities of the Partnership to Fight Chronic Disease and encourage all Iowans to support their historic policy resolution at our First in the Nation caucuses on January 3rd, 2008, and I will sign.
This is about real people, real families, and real communities in Iowa.
To the extent that we focus attention through a resolution, not just on health care, but specifically on chronic disease management and control, we inform the debate. We actually shape it. So not only do we have this great responsibility and opportunity to help select a president, but we also have an opportunity to determine what they're going to talk about. Well, golly, that's just that's a great chance for us.
To have these resolutions January 3rd in the public domain, I think could really better inform people of what their role is in terms of preventing or managing chronic disease.
Iowans have an extraordinary opportunity on January 3rd to really change the face of chronic disease in our state, to get a handle on this whole situation. It is an epidemic that I can't even explain how huge it is. We have a great opportunity to do something about this, to make some changes. Let's quit just talking about this. Let's quit just talking about it. Let's actually do something about this, because what we've been doing in the past is not working, and we have an opportunity to change things. We need to make some changes.